South Dakota is among the states where abortion services would immediately become illegal if Roe is overturned. Janet Shamlian visited a clinic in Sioux Falls where providers are taking extraordinary measures to ensure women do have access for now.
Dr. Sarah Traxler has full days at the Planned Parenthood clinic in Sioux Falls. But her day started hours before she even walked in the door.
What's your round trip commute in miles?
Oof. Oh, I don't know.
Hundreds.
Yes.
Even though Traxler is the chief medical officer of the clinic, the only abortion provider in South Dakota, she lives in Minnesota. Her trip to work involves going to the Minneapolis airport, taking the flight, being met by a security officer in Sioux Falls for her safety, then a drive to the clinic.
I was afraid I wasn't actually going to be able to make it.
A commute the mom of two has taken monthly for the last 7 years.
I sort of feel at some level if I don't do it and the other 3 physicians who do it with me, who else is going to do it? There wouldn't be anything for these patients.
The clinic says it hasn't been able to get in-state doctors who fear harassment. This nurse is the health clinic manager.
Why aren't there more clinics in this state?
It's because of the atmosphere in this state and how unfriendly it is and how unsafe it makes people feel to work here, also to seek the care that they are allowed to seek.
South Dakota is one of 6 states with just 1 abortion provider, and it has some of the nation's strictest abortion laws, including a 72-hour waiting period between consultation and procedure, regardless of whether it's a surgical or medication abortion.
I've noticed on their charts.
Dr. Traxler has to make 2 trips a week because the same doctor is required for both appointments.
You're making a big sacrifice, but what are the patients telling you about their journeys?
I mean, I think that their sacrifice is more than mine. They are leaving their children, they are leaving their jobs, they are losing wages, they are having to find travel money.
Republican Governor Kristi Noem is pushing legislation that would require 3 trips for a medication abortion, the consultation, and 1 for each dose of the abortion pill. She argues it's out of concern for women's safety. If it passes, the clinic says logistics would make it almost impossible to continue offering medication abortions.
These restrictions are going to disproportionately impact already marginalized communities that already have a difficult time accessing, healthcare in general, but abortion care specifically.
On this day, Dr. Traxler saw 10 patients. Everything went to plan until her return flight, the only flight home, canceled due to weather. In a state where nothing about abortion is easy. For CBS Mornings, I'm Janet Shamlian.